Transgender Athletes, Jessica Castillo, Social Inequalities, 3306. Transgender, individuals whose gender identity does not match their sex assigned at birth. Barriers in athletics, structural barriers and social barriers. The structural barriers consist of policies that may prevent transgender individuals from playing on the sports teams matching their gender identity. When it comes to the social portion of those barriers, they can face ignorance from staff, teammates, and even the public. And when it comes to big sporting events such as the Olympics, they lack the support from their hometown or even their country. Selection for such team is based upon competitive skill or the activity involved is a contact sport. The Title X and the Equal Protections Clause. Schools should allow transgender students to play on sports teams that correspond to their gender identity, except in cases where there is a fairness of concern, meaning there could be the possibility of an individual taking too much hormones or testosterone that will benefit the opposite team. Sports in college and high school. When transgender individuals are allowed to participate in such sports with the gender they identify as, they have a better opportunity at being more social and have an all-around emotional well-being. Participation in sports. Transgender students benefit from participating in school sports in more important ways such as reducing the chances of chronic diseases, have a healthier mental health, reduce the risk of depression, and even suicide. Students also gain a better academic performance while it allows for their peers to have a better look at them and being more accepting. The guidelines. There is a need of guidelines being more inclusive, as it would allow for more transgender students to feel more accepted. Such guidelines include permission from transgender female students who have started taking hormones to participate with women's teams. Treatment to transgenders. Transgender people face discrimination in many areas, such as in sports and healthcare. They are denied care, professionals refuse to discuss transgender specific health concerns, and they also speak to them in hurtful comments. Three main themes with transgender experiences with athletic trainers: education, primacy of the patients, environment. Education. Medical professionals lack knowledge of the needs of transgender athletes. The athletic trainers are usually unaccepting and are unable to properly interact with the athletes. Primacy of the patient. Advocating for participants' needs, recognizing conflicts, and providing the best possible care, while also respecting confidentiality, is often missed with transgender patients. Most athletic trainers come off as being more sarcastic and demonstrate their lack of care for the transgender athletes. The environment. The athletic training facilities influence the comfort with seeking care from athletic trainers. Reactions given would not be acceptable due to being transgender, and question on their abilities against members of their team that were born with their specific sex. Athletic trainers. Athletic trainers need to improve their care of transgender trainees through multiple methods that can promise a change and a better perspective when it comes to transgender involvement in sports. Improvement for transgender sports. There is a need of better education about transgender people in athletic training. There needs to be an open mind and using gender inclusive language as well. Thank you for your time.